Chairman, members of the board, and Dr. Casey, in accordance with the county charter, thank you for the opportunity to present an annual update on the activities of the Chesterfield Community Services Board. I'm Nick Pappas. I'm Vice Chair of the CSB, and it's my privilege to bring you greetings on behalf of our board. Though we're still dealing with the COVID variant, it's nice to be in here in person with you all today. I'd also like to take this opportunity to thank the Board of Supervisors and the county administration for your ongoing support and your advocacy for the services that the CSB provides. It is much appreciated and recognized. Before I turn it over to Kelly Freed, our Executive Director, I just want to take a moment to say, we mentioned COVID, we mentioned everyday excellence, and I'd be remiss as a member of our board if I didn't recognize the outstanding contribution and efforts of our staff over the last year and a half. From Kelly Freed to our senior management team who are joining us here today, to everybody who works at Chesterfield Mental Health, they have really stepped up during an extraordinary time and provided services to among the most vulnerable people in this county. And as a board, we truly appreciate that. So thank you. Kelly, you're up.
Thanks so much, Nick. Mr. Chairman, members of the board, Dr. Casey, our mission is really to provide quality services that lead to better health and recovery, and staff have truly fulfilled this mission over the past year as we continue to deal with the effects of COVID-19. There is no doubt that it's due to the diligence of our staff that we have been able to come through and continue through this pandemic with very minimal impacts to those we serve, especially to those in our residential services. We serve approximately 90 individuals, and absolutely are proud of our residential staff who have just been working diligently following CDC and Department of Health guidelines. And we've had some breakthrough cases and things along the way, but one thing we know for sure is the vaccines are working for our individuals who are very compromised. And so even with those cases, we're doing very well overall. Just looking at individuals served real quickly, we served about 6,500 individuals over the last year, just a little bit lower than the previous year, and mainly, again, due to COVID and the fact that some individuals want to shelter in place. We do provide telehealth services in those cases, but again, we're seeing our numbers come back up now that vaccines have become available. In addition, we have our strong social media presence, and we reached about 1.6 million people through various campaigns, multimedia prevention materials, the Calm, Caring, Connected Facebook campaign, and just other videos. So we have really relied on that to get the word out as well. Looking at an overview of our revenues and expenditures, our budget overall has remained about the same since the previous year, about 45 million, a little over, close to 46 million. Majority of our revenues through Medicare, Medicaid, and other insurances, and then of course our largest expenditures being in the intellectual disability, developmental disability area. Our fund balance continues to be very strong. We continue to meet all of our obligations for the Department of Behavioral Health as well as the county expectations. A little bit above our planned cap at this point, and that was mainly due to one-time monies that we received this year from a Medicaid cost settlement report as well as some retainer payments due to COVID. But as you can see, we also have planned uses on the left-hand side of the graph with 1.7 million in this particular fiscal year that we will be using towards our electronic health record. Just to talk about a few of our highlights, regardless of the pandemic, we had a very successful year and were able to meet many of our goals that we set out to attain that were aside from COVID-19. Obviously, that one was a big one for us. We had about 271 staff over the course of this pandemic that have been out at some point during the process. So that's over 50% of our staff. But we have continued to meet the demands for services, including addressing these staffing challenges as well. In January, we began the development of our new electronic health record, which will allow staff to continue to provide services in the most efficient way, and it is anticipated that we will go live with this new system next May of 22. We still continue to use telehealth too as an alternate means for individuals who have that need and are unable to come to the building for services. But again, we're seeing a fair amount of clients in the Rogers building every day. Despite the pandemic, our regulatory oversight never stopped. We have had continual audits all throughout this time frame. Just can't say enough to David Meadows, our Assistant Director of Community Services, as well as Jessica Charters, the manager. These quarterly audits have been conducted all along, and we are receiving very high marks from any reviews that we have had. In addition, we have had, Department of Behavioral Health and DMAS had a lot of initiatives with STEP Virginia prior to the pandemic, and some of those were put on the back burner. But during the last 6 months, all of that is ramped up again in a very short amount of time. Some things have had to take priority, such as transitioning our intensive community treatment program to an assertive community treatment, which is providing 24/7 supports for those with serious mental illness. And so Doug Bilski and his team, our clinical director, have just done an excellent job in getting these services in place. In addition, we are now expanding services for military service members, veterans, and their family members, as well as expanding our peer provider services. So a lot of good things are continuing to happen. Over the past 2 years, we started developing strong partnerships in the community to address housing needs, especially for those with serious mental illness where there's not a dedicated funding stream. We have several projects that are coming into fruition in 2022, and so we recently hired a housing case manager so that we can make sure that we're providing the housing supports to help individuals obtain and sustain their stable housing. Another critical partnership for us is SOAR 365, Camp Baker. They've been struggling the same way as everybody else in trying to ensure they have staffing and provide services in the safest manner possible. And I know that last October they started on a small scale of about 20 individuals, but they did hold some day camps over the summer, and they also plan to open their respite service in the next month. Again, the Delta variant is really playing havoc on being able to obtain staff or hire staff, and so this may be delayed a little bit in that process. Last year, we reported on the fact that we had hired an opioid outreach coordinator. We're now transitioning her title to substance use outreach coordinator to expand beyond opioids, but within 1 year, the efforts of Lauren Hirschler have just been amazing, and so we earned a NACO award this year for her efforts. Just over the past year, she distributed 2,310, I think, doses of Narcan out into the community, and we know based on the reports that she received back that over 253 lives were saved as a result of the Narcan that she distributed. She continues to meet regularly with Chesterfield Police, Fire and EMS to identify hotspots in the community. She conducts outreach along the motels on Route 1. She assists Chesterfield Schools resource officers with messaging around counterfeit pills. She collaborates with Department of Social Services to do training. She distributes Narcan to community corrections. She does classes for the tech center, on opioid 101. So she is just everywhere and much needed because the first quarter results in 2021, I think Virginia had the highest overdose rates in history. And so they're on record for another challenging year. Fentanyl is a big key, as we know, to this, and then also methamphetamines is also an issue. I think in the first quarter we were already at the same level as we were all of last year. So clearly that's an area that we will continue to address. We are so pleased to learn of Mr. Holland's appointment to the Opioid Abatement Authority. I know there'll be more talked about that later, but clearly this is going to be so helpful to the county and the CSB when it comes to opioid abatement efforts. Where we are for this year or coming up, we are excited. We will have our next CARF accreditation survey scheduled for October of 2021. It's actually next month. It'll be our 9th survey, and so we are looking forward to achieving another 3-year accreditation status. With the staffing challenges that we are experiencing, this is just, we know it's national, it's not unique statewide or nationally, but clearly we are feeling that too, especially in our longer term services and those for case management for individuals with developmental disabilities. And so as an agency, we are really placing an emphasis on workforce development as well as conducting an internal assessment, and will ultimately lead to an agency-wide workforce development program. I had mentioned the DOJ and STEP Virginia. You know, all of those will continue to be in play, but I think one of our biggest challenges have been the census pressures with state hospitals. While these issues have existed since the bed of last resort legislation that passed in 2014, the pandemic created staffing challenges for the hospital staff as well, which has only exacerbated our problem. There were a number of initiatives already planned as part of STEP Virginia, which I'll discuss in a minute, around crisis transformation. But then when the Marcus Alert legislation was passed in the last General Assembly, this has only added additional components that will be key for us to focus on in the next year. Before I specifically talk about those, I just want to mention that, all of these initiatives and responses occur because of the critical, strong partnerships that we have in place here in Chesterfield. And so I just can't say how proud I am to work alongside Chief Center, Chief Katz, or Colonel Katz, and Sheriff Leonard. We truly partner together in so many different initiatives, and it will only be more critical as we move into these next areas around the Marcus Alert legislation. Specifically talking about the transformation of the crisis system, it's important to note that the hospital bed shortage is really due to two issues. There's issues on the front end, which is where this crisis transformation comes in, but there's also issues on the back end for individuals who are ready to be discharged. There are not adequate placements for them to go. And so there's work being done on both ends, but specifically on the front end when it talks about this crisis transformation, the goal is to have more crisis community response with the goal of stabilizing individuals and getting them to the point where they don't need hospitalization and thus diverting that need for a temporary detention order. So that's really the goal. During the past year, and over the next couple of years, efforts are going to be made to really develop this coordinated response, but as the graph depicts, it's a little complicated. It's going to result in some regional call centers being developed as the main hub to take the calls. Calls will be coming in through the national 988 number that's to go effect as of next June of 22, or this June of 22, next June. That's when that will go into effect, and then we have the regular 911 calls that would be coming in, and then we have calls to crisis departments that are coming in. So all of these calls are coming in from all these different directions, and the goal is to coordinate them through the regional call center so that we can provide the appropriate behavioral health response. And so I know the graph may not be too clear, but on the bottom line, these responses could occur from no need at all because it can be handled straight over the phone to perhaps a mobile community response where crisis teams are going out into the community. And then the further you go, the more intense response there may be, ultimately leading to the pre-screening and hospitalization. Also, because of the impacts to law enforcement, the alternative transportation program that was rolled out to transport individuals to state hospitals once they're released from police custody. There's efforts to also see how that contract can be expanded so that this company would sit in the hospitals while individuals are waiting for a bed, which would free up our law enforcement from having to sit there day after day when those types of cases occur. Just to give you an idea.
That's important too, right? Because when they're with law enforcement, they have to be restrained, but once they're able to be turned over to the other organization, they can be, their restraints can be released. Isn't that correct?
There's a number of issues tied to that. That's one. The other is while they're sitting in emergency rooms for that many days, they're not getting any psychiatric help. And so the key is that we get them to a placement as soon as possible so that they can start receiving the help that they should be getting.
Ms. Freed, are you seeing any efforts on the state to meet that need? And if so, what?
That's a little bit of a challenging question. I know the state hospitals were closed for a period of time. I think they're really waning back and forth on that as well. Right now, I think it's a one-to-one. As somebody's discharged, they'll accept another individual. Clearly, there are individuals that need to be hospitalized, so that is never going to go away, but certainly if we can do more on the front end. I think what the state is, right now, all the state's efforts are into this initiative that we're saying here. How do we get more mobile response in the community? So a couple of things, the adult mobile teams are There was some funding to expand those. That's to go into effect by December 1. These regional call centers are to go into effect by December 1. The problem is Marcus Alert for regions goes into effect on December 1. So these pieces, it's the timing of it all and trying to get it straight. As far as getting folks into the hospital, I mean, again, we experience challenges. We've had a lot more support from the private hospitals to take individuals during this time, so we have seen a little bit of an improvement for that. It's really the psychiatric hospitals that are our biggest challenge right now because of the staffing shortages, and if they have COVID or anything in there, they close them down at that point and won't allow for additional admission. So, not sure that I totally answered your question, but I will say this crisis transformation is the biggest planned initiative to try to impact that on the front end. Talk a little bit about Marcus Alert. As you know, the Marcus David Peters Act was named in honor of Marcus Davis Peters, who was a young biology teacher and VCU graduate who was fatally shot. This was during a behavioral health crisis in Richmond. The Act modifies the Code of Virginia to add mental health awareness and response protocols, mainly for law enforcement when addressing behavioral health crisis situations. So really the goal of Marcus Alert is to provide a behavioral health response to a behavioral health emergency. Last year, when the General Assembly charged the Department of Behavioral Health as well as the Department of Criminal Justice Services to create a stakeholder planning group, this was to develop protocols statewide that each locality will be responsible for following. They did develop those protocols this past June, and this is to be in time for one CSB for each region to go live as of December 1. RBHA is slated to be the first in our region to implement the protocols in December. Henrico would be next year in 2022, and then we would follow in 2023. This tiered response that you see, level 1, really is just, it can go from a phone call, perhaps maybe handling the situation, or some minimal intervention, all the way to a very emergent level where emergency services or the police or others need to get involved. But I think the key thing to this model is at the very early on and at every single level, behavioral health professionals are supposed to be involved so that it's less reliant on law enforcement and more reliant on the behavioral health professionals to intervene where they can. Even though Chesterfield's not slated to implement in some time, all localities across the state are required to submit our local plan of how we're going to be becoming compliant with this by June of 2022. We already have a Chesterfield planning team working on this that includes our department, police, fire and EMS, county administration, emergency management, budget, county attorney's office. There's a number of folks coming around the table. Again, the challenge is if we don't have the pieces and parts from the crisis transformation that I talked about a few minutes ago in place, it's going to make it nearly impossible or very hard to be able to be in compliance or to develop a plan of how we would be in compliance by June. But we definitely are working with our partners who are going first, which is RBHA, and trying to learn from them along the way. We talk a lot of challenges. We talk about, most of the time it's the very difficult situations we're talking about, but I also think it's important, especially when we talk about our youth and a lot of challenges that we have seen that how COVID has impacted our youth, to really talk about a success story for a few seconds before I close. This is a story about David. David came to our services in 2017 when he presented for outpatient therapy due to concerns surrounding aggressive behaviors, anger, defiance, high conflict in the home, a lack of peer supports, problems with attention and follow-through, and conflict with any authority figures. At 12 years old, he had been living with his grandmother since the death of his parents when he was 4 years old. He had been diagnosed with reactive attachment disorder, ADHD, disruptive mood dysregulation disorder. He struggled making friends, using appropriate social skills, and communicating his needs effectively. Early in the course of treatment, it became apparent that David's grandmother was struggling to care for him. There were safety concerns around his behaviors, along with difficulties in school, and all of this put him at risk for being placed outside of the home, because she was moving to where she didn't feel like she could take care of him any longer. The Child and Adolescent Services team provided targeted case management to address the intensive system-level needs that were impacting him at school as well as home. They also added substance use therapy when he began to use marijuana, and in addition, they began addressing the underlying trauma and loss issues that he had been dealing with. As services progressed, state funding was used to access targeted services to help David process grief, loss, and trauma issues, such as summer camp opportunities for loss survivors, art therapy, and intensive in-home counseling. In 2019, David's case manager enrolled him in after-school program at Martial Arts World, which was funded through state monies for purchase of services for youth. Chesterfield's CAS team has built a strong relationship with the Martial Arts World, and their staff work collaboratively with each child as well as with our case managers to provide a supportive environment. David flourished in this setting, which provided high structure, a positive environment, opportunities to serve and help others, and in conjunction with the other services he was receiving, it helped to foster increased self-discipline, self-control, and self-regulation. He started making friends, feeling respected and encouraged by others, and was able to find healthy physical and emotional outlets to help build his confidence and self-worth. The next year, he was also diagnosed with an autism spectrum disorder in addition to his mental health concerns. However, he was mastering a wide array of positive coping skills and had access to a comprehensive array of supports, and he continued to set positive goals for himself. In the summer of 2021, which was just recently, we received a request to stop funding Martial Arts World for him, not because he was dropping out of the program, but because they had offered him a job as part of their team. He no longer needed our outpatient therapy services, and his case manager reports that he expresses stability and satisfaction with his life and continues to grow and find his place and purpose. So really, this is what it's all about. If we can get individuals who are really, really struggling and at the point of being placed out of their homes and getting them to the point where they have jobs and are just really flourishing, that's what it's all about. I do want to thank Larissa Carpenter, the manager of the CAS team, and the rest of the staff who do an outstanding work with our youth. As I close, lots of celebrations this month. September is National Recovery Month, so that's now in its 32nd year, which recognizes the millions of Americans in treatment or substance misuse, as well as the recovery service providers. It is also Suicide Prevention Month in September, and so we have the Resilient Chesterfield. That's the theme of the Chesterfield Suicide Awareness and Prevention Coalition's campaign. It's always important to note that if anyone or someone you care about is having thoughts of suicide, please reach out to the Chesterfield Crisis Intervention Line. That number is 748-6356, or the National Suicide Prevention Lifeline, which is 1-800-TALK, or 1-800-8255. And another thing we want to note is next week the CSB will be celebrating our 50th anniversary with a celebration. It's an outdoor event at the Rogers Building, and we really hope that you all will be able to attend. Again, we can't tell you how much we appreciate all the support that the board has provided over the past 50 years and will continue to provide as we look forward to the next 50. So on behalf of the board, again, Community Services Board and our department, I want to again thank you for your ongoing support. I also want to say a special thank you to the CSB board members for their strong support and advocacy for those that we serve. Also at this time, I would like to introduce the members of the senior team who are here today and ask them to please stand. Danielle Sayer, our Director of Finance, David Meadows, Director of Community Services, Doug Bilski, our Clinical Director, Yart Muchowski for Administration, Dr. Angela Catalico, and Mandy Pilk, our HR Manager. And it is truly through their leadership and the strong staff that we have that really makes all of this possible. So,
thank you.
So at this time, I'll entertain any questions.
Thank you. Questions, board members? Any comments or questions at this point? Mr. Engel?
I have a question for staff. Can we make sure that there's a link to the Community Services Board, if there's not already, and the phone numbers that she presented with the out on our website so that other people can get to those numbers? Thank you.
It's definitely posted on our website, and I'll make sure it's in all. I think it already is, but we'll make sure. Absolutely.
Excellent. Any other questions, comments? Well, I just want to thank you so very much for your report, and thank you for your coordination with police and fire that continues. We appreciate it so very much, as
They
you
are
mentioned
critical
earlier.
partners to us.
It is critical, so thank you for that effort
Thank you.
on our behalf.